A patient's arterial blood gas, ABG, shows pH 7.25, PaCO 230 mm of mercury, and HCO3 12 milliequivalent/L. What is the primary acid-base disturbance? A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Answer: B. Metabolic acidosis. Explanation: the pH is low, less than 7.35, indicating acidosis. The HCO3 is also low, which points to a metabolic origin. The low PaCO2 represents partial respiratory compensation. Which of the following is the most common cause of nephrotic syndrome in adults? A. Minimal change disease. B. Focal segmental glomerulosclerosis, FSGS. C. Membranous nephropathy. D. IgA nephropathy. Answer: B. Focal segmental glomerulosclerosis, FSGS. Explanation: while membranous nephropathy was historically cited as the most common, FSGS is now the leading cause of primary nephrotic syndrome in adults, particularly in African American populations. Minimal change disease is the leading cause in children. In the setting of rhabdomyolysis, what is the primary mechanism of acute kidney injury, AKI? A. Direct toxicity of bilirubin. B. Tubular obstruction and toxicity by myoglobin. C. Prerenal azotemia from dehydration. D. Autoimmune glomerulonephritis. Answer: B. Tubular obstruction and toxicity by myoglobin. Explanation: muscle breakdown releases myoglobin. In the presence of acidic urine, myoglobin precipitates in the tubules and causes direct oxidative stress and obstruction. A 70-year-old male with a history of atherosclerosis undergoes cardiac catheterization. 3 days later, his serum creatinine rises, and he develops blue toes and livedo reticularis. What is the most likely diagnosis? A. Contrast-induced nephropathy. B. Acute interstitial nephritis. C. Cholesterol atheroembolism. D. Renal artery stenosis. Answer: C. Cholesterol atheroembolism. Explanation: embolization of cholesterol crystals from the aorta, often triggered by vascular procedures, leads to a triad of AKI, skin findings, livedo reticularis, and eosinophilia/eosinophiluria. Which diuretic works by inhibiting the Na+/K+2Cl cotransporter in the thick ascending limb of the loop of Henle? A. Hydrochlorothiazide. B. Spironolactone. C. Furosemide. D. Acetazolamide. Answer: C. Furosemide. Explanation: loop diuretics like furosemide act on this specific cotransporter. Thiazides act on the distal convoluted tubule, and spironolactone is an aldosterone antagonist in the collecting duct. What is the most common type of renal stone worldwide? A. Uric acid stones. B. Calcium oxalate stones. C. Struvite, staghorn, stones. D. Cystine stones. Answer: B. Calcium oxalate stones. Explanation: calcium oxalate accounts for roughly 75 to 80% of all kidney stones. Struvite stones are usually associated with infections by urease-producing bacteria like Proteus. Which electrolyte abnormality is most likely to cause a U wave on an EKG? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer: B. Hypokalemia. Explanation: hypokalemia typically presents with flattened T waves, ST depression, and the appearance of a U wave, a small wave following the T wave. A patient has a plasma sodium of 120 milliequivalent/L. If you correct this hyponatremia too rapidly, which neurological complication are you most concerned about? A. Cerebral edema. B. Wernicke encephalopathy. C. Osmotic demyelination syndrome, central pontine myelinolysis. D. Status epilepticus. Answer: C. Osmotic demyelination syndrome, central pontine myelinolysis. Explanation: rapidly increasing sodium pulls water out of brain cells too quickly. This can lead to osmotic demyelination syndrome, causing paralysis or locked-in syndrome. Which of the following is a classic finding in acute interstitial nephritis, AIN? A. Red blood cell casts. B. Fatty Maltese cross casts. C. White blood cell casts and eosinophiluria. D. Muddy brown, granular, casts. Answer: C. White blood cell casts and eosinophiluria. Explanation: AIN is often an allergic type reaction, e.g., to NSAIDs or antibiotics. The presence of WBC casts and eosinophils in the urine is highly suggestive. What is the definitive treatment for a patient with end-stage renal disease, ESRD, to improve long-term survival? A. Peritoneal dialysis. B. Hemodialysis. C. Kidney transplantation. D. Strict low-protein diet. Answer: C. Kidney transplantation. Explanation: while dialysis is life-saving, kidney transplantation provides the best long-term survival outcomes and quality of life for patients with ESRD compared to chronic dialysis.